Genitourinary trauma epidemiology, that is age most common 20 to 35. Most injury sex males. Etiological factor blunt trauma account for 90%. Most frequent blunt trauma major motor vehicle collision, automobile, pedestrian, bicycle falls less frequently after assault, sports related injuries, penetrating trauma, injuries of the kidney. Epidemiology incidents following hepatic and splenic injury. Renal injuries are the third most common injured abdominal structures, affecting 10% of patients with a major traumatic injury. However, it is the most common of all urological injuries in children. Kidneys are the most common organ injured because of their relatively larger size and incomplete ossification of overlying 10th and 11th protecting rib. They ossify at 20 to 30 years. In children, kidney trauma is also the second most common cause of death after head injury. Incidence increased when the kidney is diseased or when there is a scanty perinephric fat. Etiological factor: blunted renal trauma account for 80 to 85% of all renal injuries and 5 times more common than penetrating injury. About 20% of associated with a intraperitoneal injury. Most common factors are contact sports, direct blow, fall from height, domestic violence, sudden deceleration, especially motor vehicle collision. Blunt renal injuries are frequently isolated. Renal injuries are associated with a lumbar spine fracture, most commonly lumbar spine transverse process. A kidney is encapsulated and filled with blood and urine, due to which it behaves more or less like a fluid-filled balloon. In physics, such objects obey Pascal law, which states that force exerted upon any part of the enclosed fluid is transmitted equally in all directions. Thus, violent blows to kidneys resulting in bursting injuries with fragmentation and multiple dissection. Blunt force applied directly to the posterior or lateral aspect of kidney. So, in blows to loins produces contusion and laceration. Contusion may be localized or generalized. May appear as horizontal bruises corresponding to rib, corresponding to the condition may be localized markings over the posterior surface. Condition upper pole of the kidney are caused by crushing against the lower rib by force transmitted through liver. Laceration classification is same as in liver laceration. Subcapsular, transcapsular, transrenal, extending from capsule to the renal pelvis. According to modern classification, both the subcapsular and transcapsular would be classified as a grade 2 and a grade 3 injury. According to the depth, transrenal would be for type 4 injury. May cause hemorrhage into the perinephric fat and form a large perirenal hematoma. Large transrenal laceration may cause quick death. Laceration of renal pedicle grade 5 injury. Tearing of renal artery may cause sudden death. Partial tear of renal artery may followed by thrombosis and renal infection. Even a condition of pedicle may cause infection by causing arterial spasm. Rarely a large retroperitoneal hematoma may form and cause death. Injury, renal injury scale. Organ injury scaling, a committee of the American Association of the Surgery of Trauma and ASST, that is divides the renal injury scale, which divides into 5 types according to severity. Grade 1. Grade 1 എന്ന് പറയുമ്പോൾ condition. Grade 2, non-expanding perirenal hematoma, laceration less than 1 cm deep in periparenchyma without urinary extravasation. Grade 3, laceration more than 1 point deep in parenchyma without collecting system rupture or extravasation. Grade 4, parenchymal laceration extending through renal cortex, renal medulla and collecting system. There is main renal artery or vein injury, but the hemorrhage is contained. Grade 5 or 5 shattered kidney with avulsion of renal hilum. Kidney is completely devascularized. Thank you.